the president of the partnership. Nice to see y'all.
And Kevin?
Sure. Kevin Collins. I'm a director of family services.
And Jack?
Hey everyone, my name is Jack Sixtus, and I'm the product lead over the Help and Hope program.
Fantastic. Well, for those of you who aren't familiar with the partnership and the work that we do, we're the result of a somewhat recent merger between the Center on Addiction and the Partnership for Drug-Free Kids, and we've united under the banner of our new name and our new brand of Partnership to End Addiction. We bring all of the research and policy expertise of the center, along with the mass communications and public service announcements, as well as direct services to families from the partnership side of the house. And we are united to really help families and help give them the support that they need, help them find the answers that they need and the support from all of our resources, which you'll hear more about today, everything from a helpline to a parent coaching program to a Help and Hope by Text program. And the idea is really to meet families where they are, whether that is in prevention mode or in needing to find treatment for a loved one or supporting a loved one in recovery. And we do so through all these different programs, as well as a wealth of resources on our website, drugfree.org, which I invite you to take a look at if you haven't already. Next slide, Jack. As I mentioned, families are at the center of everything that we do at the partnership. And we make sure that our resources are informed by families and the needs that they have, as well as making sure that they are based in science, they're easy to understand, and they're very accessible. So we're looking forward to talking to you today about Help and Hope by Text, which is one of our key programs to serve families and offer them the support that they may need in a very personalized, curated way. You're going to hear from Kevin and Jack and Fred today in more detail about that program, but we hope to have a conversation with you at the end about ways that you are able to promote this program, which is free to families, promote it out to people in your state if it is if you think it will be of use to them, which we hope you will. It is receiving really we've received tremendous feedback from families about how useful this program is to them, and we hope that you'll walk away from today's presentation understanding that a little bit more. For those of you who want to have one-on-one conversations with us, we're also open to talking about how we can personalize this program for your state. So just as you're hearing all the information today, just understand that there's sort of those two possibilities that we want to talk to you about today, and really hope that you enjoy this presentation and walk away with an understanding of this program. So with that, I turn it over to my colleagues.
Awesome. Thank you so much, Marcia. Kevin, you're up.
Yeah, great. Thanks. So just really want to quickly go through the family services that we offer, and Help and Hope is within the context of the larger ecosystem and continuum of services that we provide. The nice thing is that they're all mutually supportive and integrated, so that when someone comes in and signs up for Help and Hope, for example, they can always reach out to the helpline. They can take part in online support groups, and so they all support one another. The helpline is our probably one of our better known services. It is not a crisis line, but it is a line where parents and caregivers, really anyone who's concerned about another person using substances, can reach out to us and just express concern. So we get calls of, my kid's turning 12. I know I need to have the drug talk. I'm not sure what to say. We have people who child is 50 years old and they say, my kid's been in and out of treatment for years. I don't know what's going to happen after we're gone. And we have everything in between. So our helpline is staffed by professionals, clinical professionals who are there to provide answers and support to people who are contacting us. Help and Hope, we're going to talk a lot more about today. Online support groups we have 4 basically Zoom calls facilitated by our parent coaches. They last about an hour. They're really designed to be educational, really a lot of learning happening there. So we have 4 of those. We expanded it due to COVID, and we've had great participation and support there. Digital resources, if you come to our website, drugfree.org, social media, that's where we probably serve the largest number of people, but we want to be a place where families can come to find answers and support. Community education and e-learning. We've been doing community education for years in a train-the-trainer setting. We've got a number of presentations that can be used. But this past year, we also built a skills course for parents where they can come in and learn how to connect and communicate with their child better. And finally, parent coaching is probably closest to my heart. It is set up to provide peer support for families who are concerned about their child's substance use. All of our parent coaches have lived experience. Some have lost children, some have lost more than one child. Some have kids who are still using, and some have kids who are in recovery. And all what they have in common is they all want to help another parent who's who's walking in the shoes that they walked in the past. And they, to a person, they say, I wish I had someone like this when I was going through this, when I was struggling with my child. So it's a program we've had around for a number of years. It's and really a place that really kind of drives a lot of the work that we do. So again, just touching on all that, happy to answer more questions as we get to the end, but I want to turn it over to my colleagues to talk about Help and Hope.
All right, here we are. We're settled in, and I'll do some talking. Kevin, Fred, feel free to jump in as you're prompted or compelled to do so. And also, I sure if you want to add any questions or anything that kind of jumps out to you in the chat, I would be certainly happy to kind of respond to those when I am not speaking. So we'll kind of dive into Help and Hope by Text. And just to kind of share with you a brief overview of this program, it's an automated text messaging program that provides support, education, and resources to those seeking to help a loved one. So the nice thing about this is that it is a simple keyword sign up, which we're going to show a demo at the end of this. And all you have to do is text the word join to 55753. And that kind of starts the engagement. Within the engagement, you'll see the first kind of part is we ask you to fill out an assessment. When you fill out that assessment, we kind of put you in different buckets, or we call them tracks. And these buckets would be maybe prevention, intervention, my loved one struggling and not motivated for treatment. We also have just started testing live medications for addiction treatment track. We also have a COVID program out. We'll kind of go over the full suite, but through the assessment, it kind of gets you to where you're going. And really those buckets are designed to share very personalized content with those individuals. We pull from both internal content that we have developed for those need states, and we also have external content. And we also really look at kind of our target audience, which is parents, grandparents, partners, friends. We've recently really been working on expanding that to pretty much anybody that is in a caregiver role, which was really important to us. And our programs range from 3 days all the way from kind of our RX program, just here's 3 days of a little bit of help and hope and love, all the way to 180 days, which we would consider kind of a longer passive intervention. Just, a message every 2, 3, 4 days that is just to remind you that we're here for you. Maybe here's a new article that you can read. Maybe here is an additional resource that would be helpful to you. And I always, I'm so proud to say that it's no cost to our end users, that they're able to just sign up and don't have to enter any type of payment info or anything. They're able to just start receiving that service. And on the right side, you'll see we have a little B2B flyer. And I love when you see that how it works section is simply just text join to 55753, answer a quick series of questions, and then the engagement starts with us. So just to share kind of where we're at right now. So right now we have 7 tracks that are live. We're going to demo a couple of them for you. If you were to text join to that number, you would see prevention, early use, struggling, not motivated, and struggling, motivated. And if you were to text RX to that same number, 55753, we also have medication safety programs and medication alternative programs. And right now we are in our beta testing for the MAT support program, which is also available through that 55753 number. We have a lot in development, as you can see. I'm not going to go into all of these, but really I think what we're kind of seeing within development is we can do a lot. with this technology. I think as we consider each of these programs that are currently in development and upcoming, we're really starting to learn better ways of kind of utilizing the technology that has been built out on our platform so that we can further kind of customize, refine, and personalize services that for the people that are signing up with us. So I think the biggest two things, and we're happy to kind of show one of them today, is immediate feedback. And so immediate feedback is once you finish the assessment part, we actually provide you with a narrative right then and there as your engagement starts. And it just gives you some additional information to interact with. There's something to be said for, I just kind of opened up, even if it was just to this little device, I just opened up with everything that's going on with me. And then I'm going to just get a text message. And so we've added another layer to that where we give you your own personalized web page that is, has content that's really tailored to what's going on for you. So really starting to have a better understanding of the platform that we use and the technical abilities that we have really kind of helps further personalization for both localizing resources as well as providing additional content. So to dive in, this is just a little bit on development of a program. So we kind of have two languages. Messages are customized by base programs, and base programs are basically a main narrative structure that every person will get. So I think a great example of that is our medication for addictions treatment program, is that if you kind of get put into that bucket, we're going to send you 30 messages of the things that we feel are most important for you to know if you're in medications for addictions treatment. But then on top of that, you just answered, I think it's 12 other questions, kind of depending on how you're feeling about MAT, the type of MAT, additional concerns, are you worried about additional substances? So then we have all these assessment answers. And we also will then map additional content onto those assessment answers. So with your base program, and then all of the answers to your assessments will create your entire program. And I think one version or way to say that, so at the end of the MAT program, given all the different answers you have, we have 2.2 million unique programs that are provided by all of those assessment answers as well as the base program, which is really personal, right? That it means 2.2 million people can enroll, and depending on all their different options, would get different programs that are really tailored to their experience. And so on the content side, which is where honestly a lot of this work comes from, we have 4 types of messages that we kind of pull from as we're sitting in the lab thinking like, how can we, create this next message? There's hopeful messages. We have directive and intervention messages, where we really think about kind of scaffolding those. So maybe early on in the program, we would have kind of some type of real light type of behavioral activation, or maybe even just kind of more of a cognitive challenge when thinking about a behavioral activation. And then as you move through the program, we might challenge you a little bit more on some of those directives, right? We might challenge you to go and have that hard conversation with your loved one that you've been really putting off, or it's really hard for you to do that. So we're really intentional about scaffolding with any type of directive. And then I think primarily our messages would mostly fall under the informational, educational category. This is psychoeducation, right? Maybe here's a little bit more you can learn. If you're really upset that your loved one's with medication for addiction treatment, here's maybe a little, pamphlet or flyer or a really great article or blog post that we have vetted that will help you with that. And then lastly, we have kind of program or assessment specific messages. These kind of fall outside and are really just content that is tailored towards some of those assessment answers. And so we come up and we kind of sit and create all this content, and then we bring in expert readers. And so there's been lots of testing, I know, on the positive parenting program that is in development. There was a lot of feedback that was generated on like what kind of messages are helpful, what kind of messages really resonate with individuals, and what kind of messages aren't helpful. And then we also, for Matt, for example, we had, I think we had several roundtables, but we had one with researchers for medication for addiction treatment. We had one with individuals that had worked in programs. And we had also had an interview with 2 individuals who had been on MAT at some point in their life, just to get a little bit of that experience and understanding about some of those concerns. And then kind of finally, we'll get all this content and then we program it all into the platform, and then we put it through 2 rounds of testing to get feedback. We have a really invite-only version, and then we have kind of an open version. And that way we just really start to get, what is it like being a parent who's actually currently going through this to be in this program? Is it helpful? Is it really resonating with you? Do you feel like maybe the messages are not that helpful? All of that feedback we really open up and try and learn. So we're kind of in these continual periods of refinement. And then lastly, we have keywords. And keywords, I think, are a great way of customization, which we'll get to in our next slide. But you can add keywords within your program, which are going to add additional content onto that. So I'll go over to customization. And customization, this is where we really get into the nuts and bolts of like, what are all the things we can do to build a program? And there's lots of different iterations of this, really kind of depending on what do you want to do. So we always start with a primary track. What is kind of the length of the program? Do we want this to be something that somebody gets one message for, every day for 10 days? Do we want this to be a year-long program where we're sending one message a week? Primary track creates kind of that base narrative that everyone will get. Secondary tracks creates an additional scheduled narrative within the primary program that leads to kind of greater specificity. So for example, I know I keep referring to the MAT one because I was just talking about it. We have the MAT primary program, but then depending on if it's opioid use disorder, alcohol use disorder, there's an additional narrative that's really specified to those particular tracks. Then we have assessment answers, which we talked about, and we can do just about anything with assessment answers. We've had Likert versions, we've had open-ended input, we've had multi. Oh, did I just cut out for a second? Yeah, sorry, I think I'm back now. Yeah, okay. So assessment answers we can do a lot with, and there's a lot of different ways to kind of navigate assessment answers. Broadcast messages are really cool, where we can go in and add a message that is unscheduled, but maybe there's something, if it's state specific, that we want to share about. We can go in and add, hey, just wanted to let you know that there's a new service available in your state or county, and we're able to send a broadcast message to all the individuals that are enrolled in that particular program. And then we also have integration into other programs. So one of my personal favorite features is that right now in the Help and Hope track, somebody can type in chat, and then our live helpline specialist that Kevin were mentioning will be able to respond to that person. And sometimes with Help and Hope programs, a message might be very activating, or they might be having a really hard day. I've seen this personally, having worked on the helpline, of somebody might respond and saying, that's exactly what I needed to hear. I just found out my loved one is doing, XYZ. I just found marijuana in my loved one's backpack, and they promised me they would stop. They just finished treatment. I don't know what to do. Helpline specialists can, at that point, interact with the user that's in the program, which is an amazing feature to be able to offer, kind of oscillating between the automated and the synchronous. Again, I mentioned keywords, and we can do just about anything with keywords. We could add state-specific keywords. We can kind of modulate programs. We added the COVID keyword, which almost overlays a 30-day COVID program on top of whatever track that they're in. Or we'll demo the word hope, and if somebody types in the word hope, we just send one message that just provides a little hope for that day. And then lastly, we're only doing things by text right now, but we do have lots of options for the delivery mechanism. There's certainly an option for email, as well as there is for phone, where we can send out a phone message at different intervals. Certainly those will take different lifts and will require kind of different inputs, but overall we have flexibility in how we deliver this content as well. Kevin, I think, yeah, this one's you.
Yeah, great. So, obviously a lot of work is going into this. So let's ask the question, why? Why is this important? Why are we putting this amount of work into this? And the first reason is because it's scalable. We've talked about some of our other services, the helpline, for example. We're a nonprofit. We have a limited number of staff who we can hire to be able to respond to people. What Help and Hope is scalable. We could have tens of thousands, million people, participate in this program to really reach the large numbers of families who are being affected by substance use in the United States. So the scalability is really critical to us. We like this because it's accessible, because our goal being to end addiction. Pretty much everyone these days has a cell phone in their pocket, so this makes it accessible. Even if you don't have a laptop, even if you don't have great Wi-Fi in your home, you have the ability to access this really important information. There's the flexibility. This is built so that if there is, for example, new substances which come on the fore, or if we have a resurgence of a drug which may have fallen off, or if there is a new concern that has arisen within the United States, we have the ability to address that due to the flexibility. And then finally it is customizable. So we have the ability to really customize to ultra brief intervention or to long form support, depending upon what the needs are. So again, the ability to take this this core program, this core technology, this approach, the ability to grow it to reach lots of people, make it accessible to people, the flexibility is important, and then the fact that it is so customizable are all the reasons why we're putting so much work into this. And I'll pass it back over to you, Jack.
Computer's just been very finicky today, everyone, so I apologize for that. So we're going to show a demo, and I will just kind of talk over it so that you can understand how this ties into what I was sharing earlier. I'm going to stop share here and pull this up. Give me 1 second here. One. All right. Can everyone see that? Oh, could everyone see that? I lost everybody. Okay, perfect. Let's try one more time. All right, here we go. So on the demo, you will start to see, and this is real time that I went on. This is my phone. So I went on real time and I typed in 55753. And if I just typed in the word join, it will start the process. So this is going to be this is going to be what somebody sees when they sign up. It'll ask you to reply with yes, and it also has our terms of service. When we do that and reply yes, it's now going to send the assessment message. And this is, again, kind of that intake process where you go in and answer those questions about yourself. So you'll kind of get an idea of just how this works. So it'll take you to a web page on your phone. You can go in. I think you all know my name is Jack, and I think I entered the zip code of, childhood. So as you can see, these are kind of the initial buckets that we start to put in. So I selected the MAT program, and I go through this really quickly because it takes about a minute, minute and a half to go through. But as you can see, these are all math-related questions. And so as I'm answering these, it's starting to generate that program. So we finalize and we follow up with a message just saying that we've received assessment. And now I'm going to show a couple of keywords here. So if I type in hope, I get a message back of hope. And I also think this is the COVID program. So hope, again, is one message, where COVID would now send me one message for 30 days. And we actually have recently updated that COVID program with additional vaccine resources as well. At any time, if somebody wants to stop, they can text the word drop to us. Drop is awesome because they can still contact the helpline by texting chat. And an individual could text stop at any time to totally seize any type of interaction. And so you can see here, I tried the chat functionality as well. Now, this was me. You'll see test, but I actually typed this message. On the platform, one of our helpline specialists that are working will respond to you. So if they type chat, they get this message indicating our hours. And then you will see here, now I'm actually on my computer when I was doing this, and I send a message to myself as a helpline specialist. any second now. There we go. Yep. So you can see that that would be an actual individual then interacting with the individual that's on this line. And I think the last part is I'm going to show just a quick demo on the RX program. And the thing that I want to show here is one that you can have a different sign-up process with a different assessment. And this will also be the opportunity where you can see that immediate feedback feature that we mentioned earlier. So we'll go through, and just like last time, we get your assessment, we go through. This is actually a much shorter term program, so that you'll see the assessment, I think, is only 3 questions. And these would be the buckets that somebody is getting put into. So myself, 3, 5, 7 days, and then you can do a multi-select on this question. And once you hit submit, this would be the immediate feedback function, which I'll share. And I'm actually going to pause my screen. And as you can see, this kind of piece of content is all generated from some of the answers that I selected on the assessment. So we have some headers in there, and that will actually, the URL will actually now get texted to me immediately as well, so that individuals can pull the same web page that I just had up. They can easily recall it. So that's kind of the Help and Hope demonstration. And I do encourage, if any of you are interested, that is something that any of you can enroll in right now, doing the same process I just did. That is available right now for any individuals or yourselves that might be interested. And I'm going to pull back up the PowerPoint. Just give me a second here. And Kevin, I think this one was back to you.
Sure. And, we have been doing assessment of the program from the inception. I think Jack has given you a sense of the alpha test, the beta test, but then we also have ongoing opportunities for feedback, 7-day follow-up, 30-day follow-up for participants to just let us know what they think about the program. We had a more formalized assessment from an external partner in the 4th quarter of 2020, and we just got the report back. So you can read these. I won't read them for you, but just the one I will read is in the top left corner. I just want to say thank you. These texts saved me many days. Again, just when people are given the opportunity to give open-ended feedback about the program, it has been very positive. And we're working on the constructive comments that people have provided as well to make the program even better. We're very committed to continuous quality improvement of this and all of our family service programs.
Wonderful, thank you. I just wanted to jump in with a couple of not clarifications, but just a little more descriptive about what some of the options are. The options range for states from a link on your site. It's free. You put the link on your site, someone can sign up. You can just have text join to 55753. There's a hybrid option where you can do that as well as, co-brand it type thing if you're interested in that. And there's also ultra customization. So not only is it customization in the program, but there's customization by the state. So there's options for states to have their own programming, create their own messaging program, develop their own messages, use our base library of messages, and to tweak whatever those messages are to your own needs. There's also the opportunity for hyper localization. For example, we're working with the state on integrating a number of the resources for that state, some of the recovery centers into the program. And there's also opportunity integrated into your helpline. And that's a whole nother discussion as well. Many states have their own helplines. We can figure out a way to trigger your helpline. For example, there's also opportunities if you don't have a CRM to use our CRM to trigger the program, and even to have some interoperability between whatever system you're using in this system. Some more complex than the other, the easiest being a link on the site for your constituents, but there's multiple options of customization in the actual program. but also for your needs.
Thank you, Fred. So we've gone over a lot of information today, and a lot of it is really technical. We'd love to open it up now to questions and answers to see if there are any issues we can clarify or other questions that we can answer for you. So if people want to put the questions in the chat, I think that is the easiest way to go about doing it. And while we're waiting for folks to type some things in, Fred mentioned being able to put things on your website. If folks are interested, we also could provide you with some social media tools for you to promote this to folks in your state as a free resource. And that would be, as is, without customization, that's completely free for you all to do this. We would love to be able to make sure that everyone in your states knows this is a resource that's available. We're happy to talk to any other partners in your state who might be interested in pushing this out and making sure that people know about it, or in partnering in any way to customize. So just want to throw those pieces out to everyone as fodder for thought as well. We have a question. Hold on. Are you already working with any states to serve their addiction services needs? Yes, we definitely are. We're working with a number of states. Fred, you want to talk a little bit about how we're working with Oasis in New York and how we've worked with Delaware as well, and the partnerships that we're growing with Maine and others?
Sure. I'll take New York and Delaware. Kevin, please jump in with some of the others. So in New York State, we have a relationship where we're helping them hone the New York State treatment resources. And as part of that, we do a lot of technical assistance with the state, particularly on family-based services, also person-centered care. And that's all traditional technical assistance using in-person and e-learning formats. We're also helping them and helping their Hope line and their Champ line, and as well as direct-to-consumer options to find specific New York State resources for people looking. And as part of that, what we do is we trigger the opportunity is once someone finds a resource, we enroll them. That we're using email for this specific program. As Jack mentioned, there's multiple mediums where we're following up with individuals. We're giving them the link to their resource search. We're giving them supportive messages, and we're keeping them connected to the state helpline, as well as any other opportunities they want to go to treatment. And that's both for individuals and family members. With Delaware, we did some programs. We helped in terms of their family programming, and we did some one-offs in terms of COVID. For example, they were looking for a COVID text messaging program. They wanted a program that was for both SUD and mental health, and they wanted to keep it simple. So we created a COVID Hope program for them, which had about 15 messages over a 60-day period where people could get all the resources they needed. And it was quite simple. They create a keyword, they market it, someone enters the keyword, and then we're able to connect people to all of their resources. Kevin, you want to jump on Maine and some of the other programs?
Sure, absolutely. So Maine is part of a larger effort that we're undertaking with HIDA. Some of you may be familiar with ODMAP, which is a program that maps overdoses across the United States to identify when spikes occur. So what we're setting up is a program so that when people text spike to, will be actually a different number than 55753, but when they text in spike, they'll be registered to receive notifications when spikes occur in their community. It is a pilot program we have underway. So We're doing this with a few counties across the country, as well as the whole state of Maine as well. So what will happen is that, again, in Maine, you'll be parents, caregivers, as well as EMTs, healthcare providers, professionals will be able to sign up by texting in Spike, and when a spike occurs in their community, they will be notified. The nice thing about that is that people will also be able to sign up for Help and Hope messages as well to receive those messages. So you have a parent who's concerned about the potential for overdose will also receive the type of information that will help them communicate better with their child, identify treatment opportunities, and as always, be able to connect with the helpline. In Pennsylvania, we've had the opportunity to work with Drug-Free PA, Drug-Free Workplace PA, who does a fantastic job in the workplace space. They've been able to use our technology to reach out to create recovery-friendly workplaces, and they're looking to expand their work to other states as well. So again, it's a demonstration of how our technology can be applied in other circumstances. So, and one that we had hoped to launch earlier, but we've been a little bit blown off course by COVID, is to reach out to universities as well. We were looking at launching that, but then universities are a bit overwhelmed right now to try to anything new. But when we get back to some state of normalcy, our hope is to revisit that, so that colleges and universities, when this is an opportunity for them to connect with parents, to provide parents with information about the services that they may provide, and also ways that parents can continue to support their child when they're at college. So those are some of the things that we're looking at as expansions of the program.
Thanks, Kevin. The next question we have is, how could we start conversations about customizing these services for our states? We'd love to have those one-on-one conversations. And Jack, if you wouldn't mind going to the next slide where we have the contact information, we urge you to reach out to either me or my colleague Liz Cairns, and we are happy to talk about what is best in terms of the needs of your state and how we can work together to customize any of these services. As Fred mentioned, if you have a helpline, we can work that into the system. If there are special resources you want to highlight, we could work those in as well. So it really is, the possibilities are endless, and really they're just best discussed one-on-one, so we can make sure that we're meeting your needs and within the confines of the program. And we'd love to have those conversations. So feel free to reach out at any point. And are there any other questions? If not, thank you all for coming, especially on a Friday afternoon, after I'm sure what has been a long week for everyone. We really appreciate your time, really encourage you to reach out if there are any questions, or we can provide any more information. And we'll be following up with some information in case any of you want to link to this on your website. Again, we'd love to be able to make sure that we're helping as many families as possible with this free resource. So thank you all for coming.
Thank you. Thank you all.